Hey everybody, thanks so much for having me. I'm Dietram Scheufele. I'm a professor of science communication at the University of Wisconsin, and a lot of our work recently, for obvious reasons, has dealt with how to better communicate during a pandemic. And the bad news first, there's really no magic bullet, no silver bullet solution. There's no one single thing, if it's misinformation or anything else, that will solve this for us. But the good news is there's leverage points, things that actually may be interesting for you guys as you work on games and other kinds of interventions is the wrong word, but ways of really connecting the best available science to behaviors, to attitudes, to what people know about the pandemic. And the first thing that I want to throw out as an idea is that language really matters. How we speak about the issue will matter. The top graph here, what you see is the gray line being the willingness to purchase an energy efficient light bulb. This is work out of Wharton at Penn. And on the x-axis you see ideology. And there's no noticeable difference, as you can see, in terms of willingness to purchase that light bulb across levels of ideology. But it does start changing once you started looking at the green line if you slap an environmental label on the box. Why? Because now I'm telling Democrats that this is something that belongs to their tribal identity, quote unquote. And I'm telling Republicans that this really violates their tribal identity because the environment is not an issue that really fits their political ideology. No matter if that should be the case or not, but that's how it happens to be. And of course for COVID, some of the same things have happened where we've engaged in a lot of tribal sorting and mask wearing, unfortunately for a whole variety of reasons, falling into that category, but highlighting the idea of why language matters so much. That relates to a second point that I want to make, and it's not just language in the sense that how we use terms, but it's also us understanding. When I say us, I mean the scientific community, understanding what the concerns are that are out in the communities. And while it may be a public health or a scientific issue for us, why COVID may be a public health or scientific issue for us, for many Americans, it's primarily an economic issue. It's their livelihoods, it's their lives being turned upside down, not having childcare, losing the businesses that they own, or having to close them down for long periods of time. So the argument for behavioral interventions, why should I socially distance, why should I wear masks, are much less related for them to public health and much more to the economy if we can make that connection. How do we make that connection? And Goldman Sachs, I think, has talked about this effectively as The Economist, when they said, look, every time one American doesn't wear a mask for a day, we take GDP losses of about $50, and you can see how that multiplies through pretty quickly. And Goldman Sachs, of course, talking about $1 trillion that could be back in the economy if we would just socially distance, wear masks, and therefore be able to reopen so much more quickly. An effective tie between scientifically necessary interventions and values that matter to people. The third thing that I'll talk about is we often try to counter misinformation with science and are saying, why don't people believe in the science? Well, the value proposition we've made during COVID-19, and this piece at the bottom in Wired has talked about this back in March. We're saying we're going to correct misinformation based on science that itself constantly changes, that constantly proves itself wrong, and very visibly so in a very tight timeline during COVID-19. So we really need to start presenting evidence as the best available evidence that we have right now, acknowledging that it will change, predicting that it will change, and saying, well, once it does change, we'll change policies along with the science as it emerges. I put chemotherapy here as an example because that's probably one of the best illustrations of that value proposition. It says, is chemotherapy the best method we'll ever have for curing cancer? No. Is it pleasant? No. Is it 100% certain to be successful? No. And still patients are willing to do it. Why? Because it's the best available science that we have at the moment. There will be gold nanoshells, there will be targeted drug delivery to tumors, but at the moment we don't have those yet. That doesn't mean that chemotherapy is not what we should be using and is not what we consider settled science for the moment. The last thing that I'll mention, and I think this is particularly useful for games, for anything that connects people, is the idea that a lot of behavior change has absolutely nothing to do with scientific facts. We know from studies that we don't buy flood insurance because we understand the risks of flooding or because we live in a floodplain, at least not primarily so. We buy flood insurance, one of the key predictors, because our neighbors have it. Same thing for solar panels. Solar doesn't spread because people see the light and understand all of a sudden the idea of sustainable energy systems. People buy solar panels are much more likely to buy solar panels if their neighbor has bought solar panels. So this idea that we're establishing social norms that spread and that influence behavior is crucially important. The report here is by the Sean Group over in the DBAS and the Division of Behavioral and Social Sciences and Education, that they put out a couple weeks ago, maybe 4 weeks ago now, where they summarized the work on social norms and why demonstrating that everybody else is doing something may be a much stronger predictor of behavior change than anything else. So I'll leave it at that. Hopefully that gives you a couple of ideas. I'd certainly be happy to chat at any given moment. If anything wasn't clear, if you want to get feedback on things as you work on this, I think this is very cool stuff that you're doing. I'd be happy to chat at any time. So thank you again for having me.